Mini facelift is a facelift that is done on a lower scale and less invasive. And facelift, what people commonly think about is when you do a facelift that is more aggressive. But the truth is that mini facelift is not a medical term, and for every surgeon is different when a mini facelift stops and a full facelift starts. So it's not common and it's not standard across all the surgeons. It's just like saying a small car and a big car. Obviously a Mini Cooper is a small car. For many surgeons, if they just use a very little amount of dissection underneath the skin, for patients who are like very young, like 40 to 45, it's definitely a mini facelift. And when you look at somebody who's 60 and above, and you really have to be invasive and lift up the neck and take care of the neck muscles and lift up the cheeks, obviously that's more towards the full facelift. However, in the middle of between these two becomes hazy. So there's really no medical term for mini facelift. But just to answer that question, mini facelifts, which is less invasive facelifts, are designed for patients who are younger. As a result, the swelling and bruising are less. However, the results are less, but they don't need a huge lift on the face. But as we age, we're talking about 55 or 60 years old, if a person never had any procedure done before, in order to see the result, we need to be a little bit more aggressive.